James Fennish. I'm the clinic director at Village Family Clinic, talking to you today about our corporate health and wellness initiative. So this year going forward, we want to do more outreach to the community, make a healthier community. So we're offering some free community events to local businesses, local business owners, real estate offices, other medical professionals, reaching out and get a healthier environment. So we really want to help make this a healthier community. We've been in the community for 16 years. We want to do our part to reach out and make it a healthier community. So we're really trying to promote our corporate health and wellness program for this year. So I tell you a little bit about some of the things that we can offer you and your company. So first things first, we're a Village Family Clinic located in Alamucci Corporate Center. I've been here for over 16 years. And I've been lecturing all over the place. I'm James Fennish, the clinic director. I've been owning the place since 2003, and I've spoken literally all over across the country. So I've written several books. I speak in all over the country for different groups, especially locally. So we have a lot of good health talks we do. I said I've spoken all over the place. Chiropractor for wellness, back pain, health secrets revealed, healthy back and core, sleepless in Seattle is one of the most popular ones. We just gave that to Rutherford Hall Foundation. Stress Busters, another really popular talk that we do, how to eliminate stress. Sleepless in Seattle is obviously how to get a better night's sleep. Those are probably two of the most popular ones. Ergonomics for corporations is really, really popular as well. So, sitting is a new smoking. We've all been talking about the last couple of years, and that includes just sitting at our desk for 8-10 hours a day. So most of us are at our desk 10 hours a day. Then we're sitting in our car 2 hours a day, sitting on the couch 2 more hours at night. We're sitting, an improper seat position, the mouse position, the keyboard, all that stuff is really, really important. So we actually give that talk, and I've actually given it to companies that paid us to come out and take a look at their workstations as well. We also have one of our podcasts, 5 secrets for looking younger and feeling better. And we actually have a list of probably close to 50 or 60 lectures that we have done that are done up. We have the PowerPoints done. They're ready to go in a moment's notice. So we have dozens and dozens of lectures ready to go to make you and your company a healthier place. We do most of these at low or no cost at all to you or your company. We do a lot of different health screenings too. So we go out to the community, do all sorts of things. That's a body fat test on the left there. That's the on-run body fat analysis. So you get body fat and weight, BMI, those types of things. See how healthy your workplace is. We do those, come out, no charge to do that. Ergonomic station check. So we do things like come out to your workplace. We've actually done this plenty of times, looked at your workstation. So, the guy on the left there with the red X there slumping over, that's how most people are looking at the workstation. So eye strain, headaches, neck and back problems, carpal tunnel, all these workplace repetitive injuries are just due to bad ergonomics at our workstation. So we come out, check workstations for you, give tips. We have a lecture on that, or I have come out to companies and actually saw people sit, adjust their chairs, those types of things. So that's usually pretty straightforward. We can, again, do the talk in a room, or we come out and do a workstation check. And real simple things, you don't realize you're sitting 8 hours a day. Just putting the proper position can take a lot of strain off your eyes, your neck, your headaches, carpal tunnel. All those things are related to your bad workstation ergonomics. Blood pressure, again, it's really, really popular. Blood pressure, there are obviously computerized machines, but the old-fashioned enhanced blood pressure is the best way. In addition to taking a real blood pressure, we can talk to the patients as well about their blood pressure and other health problems they may be experiencing. So we do a lot of those. Digital posture analysis. This is a pretty neat program that we have, Posture Screen Mobile, so we can do this on an iPad actually, and you do need some medical knowledge to do it. But basically, we take some pictures of the person, and we can do a quick analyzation of see what their posture looks like. So we take a picture of them, analyze, right, hips higher than the left, or we risk for scoliosis. Do you have bad workplace posture? Do we have a short leg? All that stuff that used to need x-rays and things. We take a quick picture, and one of our doctors can analyze the picture in just a minute, and we can get readings of bad posture, how we're sitting at work, and all those types of things as well. So this is a really neat health screening that we offer. This is probably the neatest thing that we have here. This is our bone density scanner machine. And I'll move my head over there. So it's a bone density scanner. So we have a portable GE Achilles Express. It's a really super bone density scanner. So normally you go in the hospital, it's a whole day. You're sitting in that machine for hours and hours to get a bone density score. We can get a bone density score of your heel in a minute. It's about 2 minutes, I believe, minute and a half, 2 minutes, we get your bone density score. It'll print that graph there. We get their T-score, Z-score, and their age-matched score. So we get a risk for are there osteopenia, osteoporotic, risk for falls and breaking bones in just a matter of minutes. It prints out. They can take the printout with them. We have a sheet to kind of translate it for them. And of course, one of the doctors will go over with them. So this is really neat. You see the machine is pretty small there. It fits in a big backpack. Bring it out to your place of business or your employer's place of business, and we can do a bone density score in just a minute or two. It's something that would normally take hours in a hospital, and we often do this at no charge. Another thing that we're pretty unique at, we are DOT certified in multiple services. So we have 3 federally certified medical examiners on our staff, and federally certified medical examiners are allowed to give DOT exams. So CDL and DOT workers need a CDL physical, depending on their health, at the minimum every 2 years, more often in a lot of cases. This needs to be a federal exam that needs to be done in a federal form. And that's to drive all sorts. It's not just big trucks like there. Even horse trailers need them. School bus drivers need them. There's pretty strict federal guidelines there. So there's 3 of us here certified in that. There's almost no offices that have 3 certified examiners in them. So we do them in the clinic, 9 to 7 every day, and we can come out to you to do your exams there. So again, pretty unique services. We have group rates for one of the better costs around. And again, we can do it in our clinic, or if you have enough drivers or it's convenient, we can come out to you and do these exams as well. So that's pretty neat service as well as corporate wellness. 2 other things that we're certified in. I think we have 6 of us certified in urine and alcohol screening. So a couple things with this. A lot of companies are doing random urine testing now with what's going on. There's a lot of companies. We do it for some schools, businesses. We can come in and do random drug testing. It's not a good idea doing it on your own employees. It brings up a lot of issues. For random in the office, there's 2 kind of things that for DOT drug testing, this needs to be sent out to a federal lab. So truck drivers need to have random drug testing, or any CDL drivers, bus drivers need to have random drug testing. We can comply with that. We do all that. And what people don't realize, even if you're one driver, so we have a lot of owner operators. I own a dump truck. I drive around all day. You have to random drug test yourself. And we will do that for you. You come to the office. How you do that random drug test is you get in a pool of like 100 of our clients, and we pull a random percentage of that for you. So people think they're exempt. You have one worker, you're not exempt. Same thing with alcohol. You have to randomly test 10% of your workers every year. And if you're the only one worker, you think you're exempt, you're not. You need to be in one of these pools. So we put you in a pool with, say, 100 people. We pull 10 people, and then you're compliant because you're in the pool. And it's a pretty low-cost, easy thing to do, but you're not exempt from that. It's a really important thing. And then back to non-DOT for the urine testing and breathalyzers. So a lot of schools, we have contract with schools to do random drug testing. 2 ways you can do that. We can bring in, we can come to you. So some of the big schools will come in and do, 50 kids in a day. We bring all the supplies and everything. And there's kind of 2 ways you can do that. You can do a rapid drug test, and they're kind of fingers that go in the urine, and you can get a reading in just a couple minutes. They're actually a newer, more CLIA certified, where the canister stays shut and measures it right in there. So nobody's even opening that up, which decreases liabilities and things like that. So you get a rapid test that way, or we can send it out to a lab. So like I said, DOT has to be sent out by law to a federally certified lab. We take the specimen, collect it, send it to the lab, get the report back for you. Or again, we can do the rapid testing in your place of business, which some of the schools and things are choosing to do because you get a reading in just a couple of minutes. There's other more into that then. And again, we can do the same thing with alcohol. The hospital sent us, we have a breathalyzer, the same one that a police station would have. It's certified every year and a whole deal. It's not something you buy at a store. It's pretty expensive. It's a calibrated unit. And we've had where people show up to work and they suspect there's alcohol, and they send us down for a breathalyzer. So we can do things like that for you as well. So pretty unique services. So again, this is brought to you by Village Family Clinic. We're located just a 2 mile or 2 off Route 80. If you need to send people to us, we can also come to you for most of these services. We've been in business for over 15 years. We do a lot of this stuff. So we really do know what we're doing. We can offer you lectures in our office. We can set up health fairs, a lot of different events we can do for you. So that's information there. So fill out the form. We can get you a chance to win an iPad. So we're giving away an iPad. If you book one of these corporate events, we can give you an iPad. We're not going to give you an iPad. We're going to enter you to win an iPad. We can't just give everyone an iPad. But so we're doing a short-term promotion to everyone that does a corporate event next few months. We're going to enter them into a pool, and we're going to pick somebody to win an iPad. So fill out the form or contact us there below, 908-813-8200. Call or text. You can also email anytime, info@hackettstownfamilyclinic.com. We can get you more information, or we're going to have the form we can fill out and book one of these events. So thanks for tuning in, and we'll talk to everybody soon.